A very good evening, friends. I'm back with the live session today on very crucial topic, that is diabetes. As you all know, diabetes is a very crippling disease worldwide. So today's topic, if you're diabetic or you have a diabetes patient in your family, then definitely you need to watch this video. Meantime, I want to know who are you all affected with diabetes, or anybody in your family members. Just let me know in the comment box. Meanwhile, I'll just share this video in different groups. As you all know, diabetes is a very crippled with diabetes. Okay, fine. So diabetes. So what is diabetes? In diabetes is a metabolic disease in which there is elevated levels of blood sugar levels. So it is basically the sugar levels which are high, which is causing the diffuse disease in the body. So what is the main hormone which is responsible for this regulating of the blood sugar? That is, hormone is insulin. Insulin is a hormone which is released from the pancreas, and it helps in regulating the blood sugar levels. So if you take the worldwide statistics, 2019, there were around 473 people affected with diabetes, 473 million people affected with diabetes. And it has been projected by 2030, 570 million people will be affected with diabetes. So it is going to increase very massively in future. And as of now, every year, 4.1 million deaths occur every year. Quite a significant problem in the world because of this lifestyle. So in this live session, you will know what is diabetes, what are the blood tests you have to do in regards to diabetes, what are the strategies to manage your diabetes, and what are the herbs which will help you in reducing your blood sugar level. Meanwhile, I want to say hi to all of you. Minis Classic, thank you very much for joining. So let me know in a comment box what are your queries, so I can address your queries later on. So meanwhile, we'll start with the session. Okay, so I mentioned you what is diabetes. Now I'll tell you what is types of diabetes. There are two types of diabetes, that is type 1 and type 2. Type 1 means juvenile, which is affected the young population, the teens, youth affected. It is just 5% of the people which is affected, and majority is type 2, which is adult type of diabetes, which affects around 95 patients, 95% of people. So what are the causes of this type 1 and type 2 diabetes? Type 1 is because of the autoimmune, where the own immune system destroys your pancreatic cells where insulin is released, and as a result, it destroys the pancreatic cells and insulin is not formed. Type 2 is where the insulin is formed, but there is insulin resistance. So the cells cannot absorb glucose because of the insulin resistance. So what could be the risk factors in type 2? It is a lifestyle, your diet. If you have a family history of diabetes, you are prone. If your age is more than 45 years, if any pregnant patients have got diabetes, they might be a risk of diabetes in future. If you have hypertension, high BP, if you have high cholesterol, you have high risk of all this diabetes. So this is type 1, type 2. What is pre-diabetic? There's one condition, pre-diabetic, where blood sugars are very high, but you are not diagnosed as diabetic because you are not reached to that level. So that is called a pre-diabetic, this condition. So now we have learned about type 1, type 2, and what are the causes. So what are the symptoms of the diabetes? It could be frequent urination, you have to go to toilet frequently, excessive, you might feeling of hungry, tiredness, weight loss. There might be a wound in your body which is not healing. Then you might have to suspect that it could be a diabetes. You might feel tiredness. It could be one of the symptoms of the diabetes. Also, If it could have a frequent urinary tract infection, then also you have to think about diabetes, because if the increased sugar level, it is prone for infection. So what are the other things, like what are the complications you have in case of a diabetes? Once your diabetes, the sugar levels are very high, it can affect each part of your body. It can eyes, you can have blindness, it can have a heart, you can have cardiac attacks, strokes. In the brain, you can have a paralysis attacks. In the lower limb, you can have a vascular disease where you are prone for amputation. The legs goes into amputation, gangrene of the legs. So it's a diffuse disease which can affect each and every part of the body. So these are the which are the complications of your diabetes. Now, one thing I want to know, I want to tell you is why this type 1 is insulin deficiency disease, where the body cannot produce insulin. So what is type 2? Type 2 is insulin resistance. So how this resistance occurs? This resistance occurs is simple, I'll tell you. There was one study which was performed where there were two groups of people. One group of people was given fat-rich diet, and other group of people were given carbohydrate-rich diet. And they came to the conclusion that the people who have fat-rich diet, their insulin levels were resistant and the sugar levels almost doubled. There was significant increase in insulin resistance in this patient, fat-rich diet. So what could be the reason? See, insulin is a hormone which helps in absorbing the blood glucose in the cells. Cells receptors are there, you require hormone insulin. That is a key. If you consider the cells as a lock, this insulin is a key. Now you require the key to put in the lock to open up, because glucose needs to enter inside the body. Without the key, the glucose cannot enter. Now what happens is, you have a type 2, you have a key which is functioning very well, you have a significant amount of insulin, but the key cannot go in the lock. So once you cannot go in the lock, it becomes jammed, the system becomes jammed. And there is, because why these systems becomes jammed? Because of the fat. Now the fat could be the dietary fat, or it could be your weight. Because of your weight, the fat could be because of your weight, obesity. This fat, what happens is, it goes into the receptors, attaches to the receptors. Also it causes inflammation, inflammatory cytokinins, and as a result, it jams the system. So the insulin doesn't bind to the cells. When the insulin doesn't bind to the cells, the glucose is not absorbed. So what happens is, the pancreas thinks like the glucose levels keeps on rising. The pancreas says now sugar is like, keeps on producing insulin, insulin, insulin. So this has happened because of the insulin resistance. The fat gets choke up the insulin receptors in the cells. So as a result, the insulin is not binding to the cells and glucose is not absorbed by the cells, and the increase in glucose level of sugar. So that's why you have this insulin resistance. So now you know why there's insulin resistance. Now I'll come to know how you diagnose diabetes. There's one test which is called glycated hemoglobin. Glycated hemoglobin. Hemoglobin is a protein which is found in the RBCs and which helps in distribution of oxygen to each and every part of a body. Now what happens is, this RBC has a lifespan of 3 months. So you have more glucose in your blood cells, the more glucose will get attached to these RBCs. Means glycated hemoglobin will help you to know whether your sugar levels are controlled or it is uncontrolled. So you have to do a glycated hemoglobin test every yearly basis, because it will help you how your glucose levels are maintained. So what is the normal levels for this glycated hemoglobin? It is less than 5.7 is normal values. 5.7 to 6.5 is pre-diabetic, and more than 6.5% is you call it as a full-blown diabetes. Now if you have glycated hemoglobin between 6 and 6.5 in that range, then your increased risk of around 25 to 50% catching up diabetes in the future in the next 5 years. So you have to maintain your glucose very level in a normal level, and that will be monitored by means of a glycated hemoglobin. So if you have diabetes, get yourself tested by means of a glycated hemoglobin. That will help you in knowing whether you have blood sugar or no. And second is testing is fasting blood sugar and postprandial. See, fasting, when you do a blood sugar, It will help you in knowing the blood sugar level at that moment only. It will not help you in monitoring your sugar levels continuously. So only that moment will tell you what is the fasting blood sugar level. So usually it's overnight fasting, 8 hours fasting. You do get a test in the morning, and the normal values should be less than 126 milligram per deciliter or 7 millimoles. Or postprandial, what you do, you take 75 grams of glucose, and after 2 years you do the blood test, and that value should be less than 200. It should not be more than 200. You can also do a random blood checkup where your values, if it is more than 200 milligram per deciliter, or you have a diabetic complaints, then it can be diagnosed as a fully blown diabetes. So get yourself tested. You have to check your regularly your fasting sugar, postprandial, random, and in addition to this, you have to check your other parameters like blood lipid levels also, because that helps you in monitoring whether there is excessive amount of lipid deposition in your body. That is also helps in you. So lipids levels also need to do your testing. So this is how you do your testing, and this is I have explained to you. Now I'll tell you what are the strategies. Meanwhile, let me know who are there online. I want to say hi to all of you all. Can you say just hi to me? Hi Shweta, thanks for your comment. So now I'll telling you what are the strategies which help you in managing your diabetes. There are 6 useful strategies, and if you follow those strategies, definitely it will make a significant difference in your life. If you have diabetes, or if you have a family member who is diabetes, it will definitely impact your diabetes. The first one is get weight reduction about 5 to 7%. Now 5 to 7% reduction. So what you have to do is you have to calculate your BMI. How your BMI is calculated? Hi Alvin. Hi to Alvin. So BMI is calculated by means of your weight and height. And BMI less than 25 is normal. 25 to 30 is in the category of obese. It is and more than 30 is obese. Sorry, 25 to 30 is it comes in the overweight category. More than 30 is obese, and more than 35 is super obese. So you have to have a BMI or less than 25, which is a normal value. Other way of monitoring your weight is you have to check your tummy weight, your tummy size. Your tummy size should be, in case of a male, your tummy size should be less than 40 inches in males. Females, it is less than 35 inches. So these are the 2 parameters which will help you in knowing whether you're obese or no. So in this case, just imagine if your BMI is more than 30 in males, you're 7 times more risk of diabetes. In females, your BMI is more than 30, you're 12 times more prone for diabetes. And if your weight, what do you call the abdominal circumference is more, which is I've given the dimensions, and definitely you are at the higher risk of getting diabetes in future, definitely. So one of the parameters is your waist size should be less, because the waist fat which is there is a very metabolically active fat, and it releases a lot of inflammatory cytokines, and it causes, I just told you, this fat gets jammed into the insulin receptors of the cell, so the glucose cannot get absorbed by the cells. What energy we require, it is not absorbed. So that's why this fats which is there, whether you're obese, the tummy fat or general body fat, gets jammed into the system and blocks the insulin receptors, and that's why it causes all these problems. So having a weight reduction of 5 to 7% will help you in reduction of 50% risk of diabetes. Now, how you can reduce? You can do exercise, 30 minutes of exercise on a regular basis. It could be walking, jogging, cycling, whatever. You have to be active. You have to at least walk for at least, if you have a mobile, you have to monitor your walking at least 10,000 to 15,000 steps on a daily basis. This is how you monitor your diabetes. In case of weight reduction, if you want to know your weight, you have to calculate your BMI. You have to check your waist circumference. If this 2 is within normal limit, then you can say you reducing your diabetic risk almost by 50 to 60%. Just imagine how the weight is directly correlated with your diabetes. So second strategy is do intermittent fasting. So I'll give you one logic is, suppose there is any leakage from water tap, if there is a leakage from water tap, so how will handle it? There is only way. Can you handle it when the tap is running and you will make, if there is a breakage somewhere, you can handle it? No. So for the leakage to block, you have to cut off the supply first and then repair the damage. This is how you manage it. Same it comes to the body. So one thing is, if you keep on eating high carb diets, your body cannot manage all these sugar levels. It becomes very difficult. So you have to cut off your sugar levels. You have to cut off your diet, that is excess sugar levels. And secondly, you have to, once you cut off, you need to give time to your body to repair. So once your supply is closed, you also need to repair here, right? How you get your body will repair? It is by means of intermittent fasting. So if you can do intermittent fasting, it is 16 hours of fasting and 8 hours of eating, then it is definitely going to control your diabetes. Even you have seen patients where you can reverse your diabetes at times, because it will help your healing your pancreatic cells. Your toxins are washed out because of this intermittent fasting. Now intermittent fasting, so if you can have a dinner around early dinner like 6 or 7 o'clock, and if you can have your breakfast next morning around 10 or 11 o'clock, it can be, you can do the fasting of 16 hours according to your schedule. There's nothing that fixed timeline thing. It is flexible. If you can manage 16 hours, whatever way you can do, that's fine. But if you can maintain a 16 hours of fasting and 8 hours of eating, that is what is required. Now if you then fasting, see that you don't have anything like tea, coffee, fruit juices, no added sugar, nothing to be have during that time. You can have water, you can have vegetable juices if required, no, not fruit juices, and cut off all the tea, coffee, milk, all the sugar items or anything. You have to just be, you can have water during the time. The morning, suppose you are releasing a fast, morning time, during the fast, you can have fun. If you require Karela juice, it is very, it's just a detox, which will help you in releasing your toxins and help you controlling your sugar levels also. So if you can take morning or Karela juice, that should be also okay. So that's intermittent fasting will help you, because in the intermittent fasting your body will get repaired and it will wash out your toxins. The doses, it is in the intermittent fasting, because you're allowing your body to repair yourself. First thing, you need to limit your intake of sugar. Secondly, you need to give your body to time to repair also. This is how you think. Consider diabetes or type 2 diabetes. What I mean is type 2 diabetes like a bowl of sugar. If your body is a bowl of sugar, over the period of time, over so many years, you keep on eating, the sugar gets filled up with the bowl. But what happens is, when you have meals, there is overspill of sugars into the blood. Now there is a bowl, it's already overfilled, there's no other space to go in. So what it did, it gets spills in the blood. Now spill in the blood, it goes to, now when you give insulin or any other this thing, what it does is it just takes the blood sugar from the blood and it deposits in the organs, different organs, whether it's the brain, whether it's the eyes, whether it's the heart, if your abdominal organs, peripheral limbs, it gets deposited there. So insulin doesn't solve your problem. It is, what it does is it reduces your blood sugar and it gets deposited in the different organs. So as a result, what will happen is, over the period of time, these organs will get rotted, because you keep on depositing in this sugars in these organs, and you think that your blood sugars are down, but this insulin will get, what happens is organs gets deposited, so the organs will get rot because of these sugar levels, high sugar level. Then over the period of time, you have to increase your insulin levels, you have to combine a lot of drugs to manage your diabetes. That becomes very, very difficult, because we are not solving the root problem. We are just giving insulin because to reduce the sugar level, but the sugar levels, you're just reducing the blood sugar levels, you're not reducing the sugar levels which is required in the body. So intermittent fasting will solve your problem, where you will burn your calories. this is the time you will burn your calories, and this will help you in coming back to your normal situation. If you can do your intermittent fasting, so weekly, if you can start with once a week, and if you can increase to twice or three times a week, it should be very ideal situation where you can, over the period of time, you'll be able to manage your diabetes very well, and you can definitely see the reduction in your blood sugar levels, in your reduction in your insulin levels and medication. So this is how you have to do insulin. Sometimes what happens, if you're fasting, you might have a fainting episode because of the hypoglycemia. You can have a little bit of jaggery during that time. You can just carry jaggery because the hypoglycemia symptoms. But over the period of time, definitely intermittent fasting will help you in reducing your sugar level. Okay, so I have given you two strategies as of now. Let me know in the comment box whether you're getting with me with the strategies with your weight and also with the intermittent fasting. Okay, this is two strategies, very, very important. Third one is I'm going to tell you is you have to eat foods with low glycemic index. Now, what do you mean by glycemic index? Glycemic index is an index where whatever you eat, how fast it is converted into glucose in the body, that is index is called glycemic index. Now there are values in this. High glycemic index is value more than 70, medium is 55 to 69, and less than 55 is low glycemic index. Okay, so now you have to take foods which are in low glycemic index, that is less than 55. So because it will help you in when you have foods of low glycemic index, the sugar levels will not shoot up very high immediately if you have these foods. It will help you in controlling your sugar levels. It will help you in reducing your weight. It will help you in reducing your cholesterol levels. So this foods, if you have in low glycemic index, it is you have to see. Now we'll say like how to find out what is the glycemic. If you just put on Google like what is the glycemic index, any food, if you say good, I'll tell you what are the foods with low glycemic. If you take fruits, guava, pomegranate, okay, these are the fruits. You can take all the vegetables are there which are low glycemic index. Okay, then you can have berries, strawberries, all these fruits, these are a low glycemic index. Any plant-based, fruit-based have a low glycemic index, but only thing is banana is slightly in the higher side, high glycemic index. Then what are the grains? The white rice is very high in glycemic index. So moment these people, diabetic people, have white rice, your blood glucose is definitely going to shoot up. So what you can do is you can replace your white rice with the brown rice or red rice, so where the glycemic index is very, very low. So you have to take foods which are low in glycemic index, like ragi, like broccoli, radish, root vegetables. These are all fruits, onion, you have cheese, proteins, fish. These are when you have a protein intake, this is which are the foods which are low in glycemic index. So you have to take foods which are low in glycemic index. If you're whatever you're eating, check out what is the glycemic index of the food. You can just Google it, whatever you're eating. If your glycemic index is low, less than 55, definitely it will benefit you in monitoring your sugar levels. So which foods are high in glycemic index? I have already told you: white rice, any white bread, white pasta, anything which is white flour. Okay, bananas are usually high in glycemic index. Any packaged food, any sugars, these are very high in glucose, high glycemic index. So try avoiding this glycemic index, high index glycemic index foods, which this will help you in monitoring your sugar levels. This is the third strategy. Fourth one is you have to monitor your intake. You have to take small meals. Now, what do you mean? Your portion should be small. Why? Because when you have a large portion at one time, it will definitely spike your sugar levels at a very high level, and it will be very difficult to reduce your sugars. So definitely you have to take small portion. When you have small portion, so definitely your sugar level is not going to shoot up very high. So pancreas knows how much insulin to be released, and once the insulin is released that much, it will definitely help in reducing your sugar level. So portion size you need to tailor down, because now I'll tell you how you can do it. You can take small plates. You do not have a big plate. You need to have everything possible. It's not possible to have everything. So you have to take a small plate, have small quantities. Second is you have to eat slowly. Now I'll tell you, there is a 80% rule you have to follow. What do you mean by this 80% rule? You have to stop eating the moment you get sensation that your tummy is full. What we do is we tend to eat more because we find it we have too much of food left in our plate, so we tend to have more. So that's why you have to have small plates. You take small quantities at starting moment. That's why you are not eating more. The brain and the stomach has a time lag of 15 minutes. When your stomach is full, the brain gets 20 minutes later sensation that your tummy is full. So this is 20 minutes lag, is the time lag between the stomach and the brain. So what will happen? How to compensate for this time lag? You can only compensate for the time lag by eating slowly. When you eat slowly, this time lag is compensated. That's why you have to control your portion size. You have to eat from a small plates. Your quantity should be reduced at one time. So that's why it will help you in better control of your sugars, better control of your diabetes. And it has been said that if you have a small portion, there was a study conducted for 2 years in pre-diabetic patients, and they found that when they have a small portion, the diabetes risk was 40 to 50% less compared to any other patients who did not have any lifestyle changes or portion changes. So if you can manage your portion, small quantities, taking smaller plate, take more time for eating, then definitely your sugar level will not spike very high, which is required. That's why how you monitor it. Fifth thing is your sleep. Sleep is very, very crucial. Now, sleeping for more than 6 to 7 hours, which is required. Now most people have erratic sleep. It could be whether the lifestyle, it could be because of your work schedule, or it could be because if you have a sleeping disorders, it could be anything. Then you are prone for diabetes. It could be type 2 diabetes. Your risk for diabetes is very, very high. Your insulin resistance also increases. There was a study done at 2010 in UK where they found out where people sleeping for less than 5 years where 25 to 30% more risk of insulin resistance and more risk for diabetes compared to people who have slept for 6 to 7 hours. So much difference it is making. So one day of sleeping, just sleeping for less than 4 or 5 hours, your insulin resistance increases very high. So see that you have an adequate sleep of 6 to 8 hours between the time. Less sleep is definitely going to hamper your sugar levels monitoring. Now, how it affects your body? How how sleep is affecting your blood sugar levels and diabetes? The first thing is it helps in increased sympathetic activity. It releases hormone. When you have a decreased sleep, it increases your hormone cortisol. So this cortisol will increase the insulin resistance. It will jam the system where the insulin receptors are there. So this is how it gets affected. Secondly, it increases when there is inadequate sleep. You're releasing a lot of inflammatory cytokines, which jams the systems also. So this is how the sleep, if you have inadequate sleep, it is definitely going to hamper your diabetes control, and also sugar levels is definitely going to shoot up. Okay. And the last is important point I want to say is monitoring your sugar levels. Monitoring, the person who monitors the sugar level will be well maintained, well managed diabetes. Now I will just tell you, if you can monitor your sugar by means of a test which I have done, fasting, postprandial, or glycosylated hemoglobin, which you can do once in a year, definitely it will help you in reducing your risk. How? Because if you can monitor just 1% reduction in glycated hemoglobin, they have shown that the reduction of blindness is reduced by 20%, the amputation rates is reduced by 40 to 50%, the complications because of diabetes is reduced due to 25 to 30% if you can monitor your blood sugar levels. So when you monitor your blood sugar levels, definitely you can monitor. When you can monitor is during your meals, before meals, after meals, before exercise, after exercise, before sleep, after sleep. So you know how your sugar levels, when the spikes occurs, which foods causes higher spikes, which foods doesn't cause higher spikes. So accordingly you can maneuver your diet. You can control your diet. You can, whichever medications you're taking, definitely you can monitor your medications also. So definitely your monitoring of diabetes is very, very important, because you can self-manage your diabetic, you can self-control your diabetes, and it is very easily done, which by means of a strips test you can do. You can just puncture the fingers at the one level and get your blood sugar tested. Don't use pricking at the same side. You can use different fingers if you have diabetes to monitor your blood sugar levels, because it can increase your callus formation and prone for infection also. So try to having blood tests regularly. Monitoring is very, very crucial, because accordingly you can monitor your diet, you can change your meals, and accordingly you can change your whatever the medications also. Mind you, diabetes is possible, you can control it. At times it can be reversed also. If you can do follow the strategies, intermittent fasting is one of the things which will help you definitely benefit of all the strategies. Okay, let me know in the comment box which strategy you have liked as of now. I have mentioned six strategies for your weight reduction, definitely very important. Second is I've mentioned about intermittent fasting. Then you have food of low glycemic index, proper sleep, monitoring, and a portion control. Yeah, so these are the six strategies which will be very crucial for you in monitoring your blood sugar levels. Now I'll be telling you now what are the herbs you can use which you can help you in reducing your sugar levels. There are six things which you can use. Anyone you can use. First thing is neem leaves. All these herbs which I'm telling you, which will help you in controlling your diabetes, it reduces your blood sugar levels, it help you in beneficial in controlling your sugar levels. So neem leaves, if you can take a few neem leaves, dry it, crush it in the blender, and make it in a powder and have it in the morning time. It will help you in controlling your diabetes and sugar level. Second is Karela juice. Karela juice, if you can have, is fresh Karela juice in the morning time. 1 glass of Karela juice in the morning time in the fasting state, and see that you don't have anything at least 45 to 50 minutes after that. This Karela juice will do wonders for you if you are diabetes, or if you're not diabetes also, it will definitely detox your body. It will remove your toxins also. So there is something called, not all of us are in the diabetic range. Could be in the pre-diabetic stage also, where your sugar levels are higher, but it is not diagnosed as diabetes. So if you're pre-diabetic state, definitely this juices, detox juices, will help you in beneficial in this. Third is jamun seeds. Jamun seeds, we used to know, we used to, in childhood days, we used to eat the jamuns, but we never knew that the seeds are very useful. If you have this, if you take water and if you have 1 teaspoon of crushed jamun seeds, definitely the sugar levels will help in better control. Fourth one is fenugreek seeds. Fenugreek seeds, which is called methi seeds. Methi seeds also same benefit, decreases your insulin resistance, stimulates your pancreas to release insulin hormone, reduces your sugar levels. You can take this in the morning. Or you can do, fenugreek seeds, you can soak it overnight in 1 or 2 teaspoons, and you can have this in the morning time with the water and the fenugreek seeds, which will help you in maintaining your sugar levels. Fifth thing is cinnamon. Cinnamon is also very, very important in managing your glucose levels. You can have in the morning time, okay, half teaspoon to 1 teaspoon in the morning time, and it will be very, very beneficial in the reducing your sugar level. So one more thing is okra, ladyfinger. If you have crushed the seeds, is very, very, okra seeds is supposed to be very good for the diabetic patient. So overnight, if you can crush some ladyfingers, okra, and with the seeds in the water, in the morning if you can have it in the juice form. So this is the 6 which will be very, very crucial for you in helping control your diabetes. First thing is neem seeds, Karela juice. You can have jamun seeds, cinnamon, fenugreek seed, and okra. These are the 6 things which will be very, very helpful for you in reducing your blood sugar levels. Mind you, diabetes, as you all say, it cannot be reversed, but definitely it can be reversed. It can be controlled, definitely, yes, it can be controlled if you follow definitely the guidelines. And see that you don't reduce, before reducing your doses, see that you take your expert opinion from the doctor, because directly I will not advise you to reduce your dosage and start this treatment. You have to do it over the period of time. You have to monitor yourself. So if you're taking insulin or if you're taking medication, see that you follow this strategies also, and over the period of time, it may take 3 or 6 months for you. You might see the changes, and then once you think like if you can monitor your glucose levels is well monitored, you can say definitely your medications level, your tablets levels can be reduced, your insulin levels will definitely come down. Definitely it will be beneficial for you. So follow these strategies and see that you monitor your blood sugar levels, because the spikes of sugar happens in between. So erratic blood sugar level monitoring is required, because if your blood sugar up and down is not good. You have to maintain it stable, and stability is maintained by following a proper diet, proper strategies, and which I have herbal remedies which I have to, which can help you in beneficial. So diabetes is definitely, it is going to increase in future because of our lifestyle, because of your unhealthy diet. If you can go on a plant-based diet, majority of time, if you have diabetes, go on a plant-based diet. Avoid meat for some time, because the red meat also increase your fat, so that can be very harmful for your body. If you are diabetes, if you can go on a plant-based salads, fruits, vegetables, which I've told you, over the period of time, you will definitely see the changes in you and also in your body, and definitely it will help you in long run. So hope this session was very helpful for you. If you like this session, I would like you to share this video to your friends, because they also can help. If they have anybody in their house, they can help in monitoring the blood sugar levels, they can help in controlling the blood sugar levels, and in long run will definitely benefit it. So it's a learning phase for all of us. So let's November 14 is a World Diabetic Day. On the same day also we are celebrating Diwali, so all we will be eating a lot of sweets also. But don't worry, once a day if you have sweets also, doesn't make a difference. But you need to definitely do your post Diwali detox also. That is also help happens. Once in a while sweets are okay. I will not say avoid completely, but see that you need to monitor your glucose levels very well. Homemade sweets, if you can go for the homemade sweets, is good. So thanks for joining all of you, and I hope this session was very helpful to you. And let me know in the comment box how helpful this strategy is. Thanks, Wilson, for your comments. Intermittent fasting strategy is something I learned new. Yeah, it is definitely very beneficial for people who can do intermittent fasting. It definitely, over the period of time, you'll be able to reduce your insulin dose, reduce your medications, and it definitely will help you in benefit, because your system works. Your body will recover on its own. You're giving time for the body to relax. You're giving time for the body to recover. So that's how it is really helpful. Follow these 6 strategies and let me know in the comment box if you have any queries. I'll be able to answer you later on. Okay, meanwhile, very wishing you all a very happy and prosperous Diwali, and good night to all of you all. Bless you all. God bless you. Thank you.